During COVID-19 crisis, there is a need to triage the patient and avoid unnecessary admissions related to trauma and other ailments. All closed fractures except displaced intra-articular fracture were conserved, keeping in mind the functionality of the joint, neurovascular deficit, and age of the patient. It would take longer duration for the patient to accommodate them to the normal lifestyle, and the functional outcomes in conservatively managed long bone fractures during COVID-19 pandemic was assessed. Material and methods, study design. This was a prospective case study, 2 months with 8 months of follow-up. My sample size was 20 patients who were having fractures of tibia, humerus, and intertrochanteric fractures with distal and radius fractures, proximal humerus with both bone forearm, and fracture of clavicles. Inclusion criteria was patient between age group of 21 and 70 years, single long bone fractures, simple fractures, and closed fractures. Exclusion criteria was compound fractures, displaced intra-articular fracture, comminuted fractures, polytrauma, and patients not willing for consent. Study method, patient demographic details were noted, site of fracture was noted. Based on the details, patients were managed with splints, DRB cast with analgesic supplement with calcium and vitamin D were given for 3 months duration. Patients were followed up at 2 weeks, 1 month, 3 months, and 6 months respectively. Patients were assessed based on verbal assessment scoring, DASH scoring, the disabilities of arm, shoulder, and hand, Harris hip score, Oxford knee score, and foot ankle scoring systems. Total out of 20 patients were studied. 3 patients came with diaphyseal tibial fractures, 3 were with proximal metaphyseal tibial fractures, and 7 were intertrochanteric fractures, and 2 patients with bimalleolar fractures, and 5 patients came with proximal humerus fracture. 7 had excellent results, 4 had good results, 6 had fair results. 1 patient each with mid-shaft tibia fracture, intra-articular fractures, intra-articular proximal tibia fracture, and with fracture distal and radius fracture had poor results in terms of radiological and functional outcome. These were the scoring system which were used. This is the bimal fracture, pre-management, the X-rays are here. At 6 weeks of cast removal, with the patient, a clinical video showing walking without any functional disability. This is a mid-shaft tibia fractures, pre-cast and post-cast. Masnovi's fracture, which was, this is pre-cast photos. The post-cast X-rays, because of the COVID-19, the patient had developed on follow-up and on telephonic conversation. The patient said he had become COVID positive and he had removed a cast at a local place in UP. So he told, but he was walking without any functional disability. Conclusion was, in the present study, the functional outcomes of the closed fractures of long bones treated with conservative management was found to be effective. It can be concluded that conservative management in the COVID-19 pandemic was found to be effective. Thank you.